Enlarged prostate. The actual cause, natural ways to prevent and treat. What does my prostate do? It is a small gland that is part of the male reproductive system. It's supposed to be about the shape and size of a walnut. It rests below your bladder and in front of your rectum. It surrounds part of the urethra, the tube in your penis, that carries pee from your bladder. The prostate helps make some of the fluid in semen, which carries sperm from your testicles, when you ejaculate. Enlarged prostate. An enlarged prostate means the gland has grown bigger. Prostate enlargement happens to almost all men as they get older. An enlarged prostate is often called benign prostatic hyperplasia, BPH. It is not cancer, and it does not raise your risk for prostate cancer. By the time you reach age 40, your prostate might have gone from the size of a walnut to the size of an apricot. By the time you reach 60, it might be the size of a lemon. Because it surrounds part of the urethra, the enlarged prostate can squeeze that tube. This causes problems when you try to pee. Typically, you won't see these problems until you're 50 or older, but they can start earlier. Causes. The actual cause of prostate enlargement is unknown. Factors linked to aging and changes in the cells of the testicles may have a role in the growth of the gland, as well as testosterone levels. Men who have had their testicles removed at a young age, for example, as a result of testicular cancer, do not develop BPH. Also, if the testicles are removed after a man develops BPH, the prostate begins to shrink in size. However, this is not a standard treatment for an enlarged prostate. The likelihood of developing an enlarged prostate increases with age. A small amount of prostate enlargement is present in many men over age 40. More than 90% of men over age 80 have the condition. Symptoms. If you have trouble starting to urinate or have to go a lot, especially at night, these could be signals that you have an enlarged prostate. Other signs and symptoms include: your bladder doesn't empty completely after you pee. You feel the need to go out of the blue with no sensation of build-up. You may stop and start several times. You have to strain to get any flow going. It's important that you see your doctor if you have early symptoms of BPH. Although rare, it can lead to serious problems such as kidney or bladder damage. A larger prostate doesn't mean you'll have more or worse symptoms. It's different for each person. In fact, some men with very large prostates have few, if any, issues. Talk to your doctor about what is best for you. Lifestyle tips that may help someone manage the symptoms of an enlarged prostate include: attempt to urinate at least once before leaving home to avoid urinary leakage or other incidents in public that can be very stressful and embarrassing. Double void by trying to urinate again a few minutes after urinating the first time to drain the bladder as much as possible during bathroom visits. Try not to drink fluids in the 2 hours before bedtime to avoid going to sleep with a full bladder. Try to stay hydrated by drinking at least 2 liters of water daily. Try maintaining a healthy body weight as much as possible. Exercise regularly and as often as possible. Try not to drink too much at one time. Try to reduce or avoid stress to reduce the urge for urination. Avoid or limit products that cause dehydration, such as cold medications and decongestants. Use absorbent urinary pads or pants to absorb urine, leaks, and decrease wetness and discomfort. Use urinary sheets, which are condom-shaped and fit over the penis, to drain urine into a small bag strapped onto the leg. Use urethral massage after urinating by gently pressing the fingers upwards from the base of the scrotum to try to squeeze out any urine left in the urethra and prevent any leakage later. Foods that may be beneficial to BPH include fiber-rich foods such as whole grains, legumes, beans, and dark, leafy greens. Fruits and vegetables rich in antioxidants, usually dark red, yellow, and orange varieties. Foods rich in zinc, such as eggs, most types of seafood, and nuts. Products that contain phytoestrogens, such as soy foods, chickpeas, alfalfa, and fava beans. Foods rich in omega-3 fatty acids, including most fish and some nuts and seeds, such as hemp and chia. Natural remedies for an enlarged prostate. Zinc. Chronic zinc deficiencies have been shown to potentially increase the likelihood of developing BPH. Taking zinc supplements or increasing dietary intake of zinc may help reduce urinary symptoms associated with an enlarged prostate. Zinc is found in poultry, seafood, and several types of seeds and nuts, such as sesame and pumpkin. Green tea. Green tea has a lot of antioxidants called catechins that have been shown to enhance the immune system and potentially slow the progression of prostate cancer. It is important to keep in mind that green tea contains caffeine. Caffeine can stimulate the bladder and cause a sudden urge to urinate, potentially worsening BPH symptoms. Cucurbita pepo pumpkin seed. Pumpkin seeds contain beta-sitosterol, a compound similar to cholesterol and found in some plants. Preliminary studies have shown that beta-sitosterol may improve urine flow and reduce the amount of urine left in the bladder after urination. Carnitine. Some people use herbal supplements made from ryegrass, pollen, to treat BPH symptoms. These troublesome symptoms may include being unable to empty the bladder fully and the need to urination frequently at nighttime. Despite its popularity, carnitine has never been shown to impact BPH symptoms in any large-scale scientific studies. However, some indicate it may help reduce the overall size of the prostate. Exercise. There is evidence to suggest that exercise can be beneficial for sufferers of an enlarged prostate. Research by the University of Harvard found that walking reduced the risk of BPH by 25%. It was also concluded that the more physically active men were, the less likely they were to experience urinary tract infections, a key symptom of BPH. Massage. Men with BPH often struggle to empty the bladder completely. To help with this, gentle massage can be applied to the area. Speak to your doctor about urethral massage before attempting to do this yourself. This will ensure you do it safely and comfortably. Thanks for watching.